Welcome everybody to this presentation from Lone Star Script Care. My name is Chris Smith and I am going to be spending the next 20 to 30 minutes with you talking about the great opportunity that is available within our company and within the industry in general. We're excited that you're here and thinking about joining the healthcare revolution. We're very excited with what the future holds in terms of the markets and how you can build a business by providing solutions to this massive problem that's faced by millions of Americans. Nobody is exempt from the rising cost of healthcare. Despite what's been happening in the press, with the Obamacare, Medicare, there is a great opportunity here to build a good, solid business where you can help people out and also make some money in the meantime. That's a pretty neat concept. So let's get started. At the end of this presentation, you're going to have some questions answered. So right now, you've reviewed a website, you've looked at, maybe what we do, you've maybe looked at our products and services, but really what you want to know at this point is what we're doing real? You're out there looking for a business opportunity, you're out there looking for a way to make an additional source of income, but also to be able to do that with a set of products and services that are in demand. So we're going to show you that it's real. We're going to show you how you can do it. And we're also going to show you how we can help you do it. There's no other company out there that has put together the program that we've put together. And you'll see why once we get further along into the presentation. So let's get started in more detail. First off, if you haven't already realized or looked at Lone Star in terms of our products and services, what you have to really realize is that our number one mission is to reduce the out-of-pocket costs for healthcare in America. That is our goal, that is our mission. If we can help somebody lower their monthly costs, whether it's through a prescription program, whether it's through a telemedicine program, a dental program, whatever it is, if we can help them lower their monthly costs, that's what we're going to be focusing on. That's our goal, that's our mission. Healthcare costs in the United States are at incredible levels. There's no signs of that slowing. It's only getting higher. These numbers every year are getting higher and higher. Out-of-pocket costs are getting out of control. And with our programs and services, we've been able to put together a program where we can really fulfill that mission. And that mission truly is to reduce the out-of-pocket costs for healthcare in America. Who's the company behind the revolution? So, Lone Star Script Care, been around for a while. We got started in 2004, basically doing prescription assistance programs. That's our kind of bread and butter. And as the years has gone by, our company has expanded. It's moved into additional markets, additional products to really tackle that mission and get to the core of resolving that healthcare problem. So we have a variety of cost reduction programs, from patient assistance programs, medical bill negotiation, telemedicine, which is the big one at the moment. We're headquartered out of Albany, New York, but we market throughout the United States, and this includes Puerto Rico, the U.S. Virginian Islands, and Guam, to name a few. So we're in every state, East Coast to West Coast, pretty much, wherever there's a need, wherever there's a problem to a healthcare cost, we're right behind them with hopefully a solution. We've helped thousands of patients throughout the United States save money on their costly prescription drugs. That was our kind of founding product, if you like, was providing access to patient assistance programs. And like I said, as the years have gone by, we have expanded that offering to provide a more robust and a bigger offering to reduce those costs. So we're a pretty stable company. With the way that the market is structured for growth in the next few years, we're going to be getting bigger and bigger. I'm pretty sure most of you have at least at some time in your life heard a news article, read something in the in the paper, on the internet, about the costs of prescription medication. This is taken from a snapshot from an ABC News presentation, which said that 72% of Americans view the cost of prescription drugs as unreasonable. Now, let me tell you, up till about 2012, the pharmaceutical industry was the most profitable industry in the United States. They're making billions and billions of dollars every year. They're coming out with new drugs. People are getting those new drugs, but the cost of those new drugs is prohibitively expensive. So saving money on prescription drug costs is a huge market. And obviously, the proof is in the pudding here, because 72% of Americans on this poll deemed the cost of their prescription drug as unreasonable. So we've provided some solutions to be able to offset that. A little bit more detail on this. Every year, more than 4 billion prescriptions are filled in the United States. That's an average of 12 prescriptions annually for every man, woman, and child. Now, obviously, some people take more than others. Some people go years without taking prescriptions. But the bottom line is this: there are 4 billion prescriptions being written, on average, in the United States year in, year out. Okay? If there was a 50% reduction in this market, there would still be 2 billion prescriptions being written. Okay? Now, is the market going to reduce? Absolutely not. Okay? Who doesn't want to make their lives healthier, make themselves live longer? Okay? Everybody wants to do that, and when there's a new medication that hits the market to be able to offer that and do that, then guess what? People are going to take it, they're going to get it prescribed, and they're going to go and try and fill it. So the market is not reducing. U.S. prescription drug sales climbed from, or is projected to climb from $320 billion in 2012 to over $500 billion in the next few years. Okay? That's a 100% increase almost. And it's going to get bigger and bigger and bigger. There's no signs of this slowing. Okay? Everybody's, spoke to us about Obamacare. We're heading towards where, people get their medication, get their insurance provided or through the government. Well, the problem is still the same. Okay? You might get access to a program, but you're still going to have to go and pay for that prescription at the local drugstore. Okay? And that's where the pricing is the worst. You get a prescription and wander down to your local corner drugstore, the pricing in those things are incredible. Why is it incredible? They've got rents to pay, they've got staff to pay, they've got everything to pay. That's why this market is so big. We also know that there are an estimated 90 million Americans without prescription drug benefits. So despite all the fanfare that you're hearing, there are still a number of people without prescription drug coverage. So what do they do when they fill a prescription? They get a cold, they get the flu, they get whatever it is. They go to the doctors, they get a prescription, they take it to the pharmacy. Wow, sticker shock. $100 for a prescription? $150 for a prescription? That's where we come in and we're able to help lower that cost. Here's a neat little kind of graph or chart on just how much prescription drugs spending per person has increased since 1970. It's incredible. You went from $43 down in 1970 all the way up to $709 in 2013. That's 1,648% more per year on prescription drugs in 2013 than in 1970. Okay? So it's a huge market, it's a huge problem. So why the big concern over RX? Why would you even consider, getting into a business that is focused on, healthcare savings and that sort of thing? Well, what we do know is that prescription drugs are the fastest growing part of the nation's healthcare expense. Pharmacy bills have become such a significant item in the budget for most families, even those that have medical insurance. We hear it all day long. We'll get somebody call, well, my copay is $250. Who can afford to go and get a drug for $250? Most people, can't afford to do that. Okay, so even if they have coverage, we might be able to provide them with a solution. The only goal we have is to lower their out-of-pocket costs. If we can do that, then we're in a great position to help them. The problem is even greater for seniors who constitute 12% of the population but use over 36% of prescription drugs. So it's even worse for those. Now, it's even worse for those because they've, got a drug plan that is really, full of holes. Okay? Deductibles, co-insurance, co-pays, donut holes, exclusions, tiers. Okay? Sometimes, you have to be a mathematician to work out how, their program works. So they're using 36% of the drugs, and they just can't afford it. It's a huge expense on their monthly bill, month in, month out. And mind you, they're on a fixed income. A senior can't say, well, next year I'm going to earn more money. Okay, it doesn't happen that way. So we know that the problem is even greater for seniors that need access to prescription drug medication. And the rest of the population, especially those without health insurance, are significantly affected by these prices. If you know somebody that's a diabetic and they don't have health coverage, a 90-day supply of an insulin product is $500, $600, $700, $800. Most people can't afford those prices, and that's where we come in. So, high deductibles and copays cause people not to use their health insurance. That's a fact. We hear it all day long where, maybe you have insurance, but the first question that you ask yourself is, how much is it going to cost? Not, will I get better? Okay? It's not, what do I need to do to get better? It's, how much will this cost? That's the very first thing that springs to mind when you have a healthcare issue. Okay? And it's because you have a high deductible, a high copay, maybe a co-insurance requirement. Okay? Any of these things are going to cause you not to use your health insurance. 50 million Americans struggle each month to afford their prescription medications. Well, we know this is a fact. And in fact, 72% say that the cost of their medications is expensive. We know these facts exist. Okay? And obviously with every problem there's a solution. We now have that solution. But look at this graph. Annual per capita healthcare costs by age. It's no surprise that the United States is one of the highest. What we've done is tracked the US, Germany, the UK, Sweden, and Spain. Okay, so we're not even dealing with, third world countries here. Second world countries. We're dealing with westernized, civilized countries where their healthcare is equally as good as, or in some cases, maybe better. Look at the costs there. US is far and above the most expensive place for healthcare costs. Now, every Obamacare enrollee needs our products. Okay, whether it's a telemedicine program, okay, whether it's a dental program, whether it's a prescription program. Most Medicare beneficiaries can use our services. Majority of small businesses need our solutions, and millions of uninsured Americans. In fact, just about everybody needs our products. Ask yourself this simple question. Who doesn't want to save on their healthcare costs? Okay? It's not something that you say, well, I'm going to go out and spend more this year because I want to, right? You don't suddenly wake up on January 1 and say, you know what, I'm going to spend more on my healthcare. You might wake up and say, well, I'm going to get a better car this year or a bigger house. Okay? But nobody gets up and says, I'm going to spend more this year on healthcare. So, everybody needs our products. Because there is such a big problem, what you find is, right behind that problem should lie a solution. And obviously we have those solutions. And when you solve their problems, when you solve a person's problems, you're going to be their hero. And we're going to show you how to become a hero. So, imagine becoming or being able to become a hero. No other business does what we do in the way that we do it. There is just no other way no other company doing what we do in the way that we do it, and we're going to show you how to do it. We're going to show you how to, if you're a recruiter, we're going to show you how to recruit. We're going to show you how to make product enrollments. Okay? And we have a turnkey operation for both of those things. Okay? You haven't got to be great at sales. You don't have to be great at product knowledge. What we're looking for is for people to be able to refer. You know, Mr. Customer, you have a problem here, or who do you know that has a problem? Here's a great company. Check them out. Let me know what you think. We're looking for referrers. Oh, and by the way, the more people you refer, the more money you're going to make. And you will make money doing this. We guarantee it. So let's take a brief look at the product solutions behind the revolution. Prescription drug savings, that's powered through our prescription assistance program. What we do there is give free medications to those that qualify. We have a prescription savings membership program. The absolute lowest cost on medications. Now with prescription programs, what we're doing here is they're already buying a product. So what we're doing in this case is reducing that monthly cost. So there really is no sale there. We're just repositioning how they purchase them. Okay? So they're already buying their medications. Maybe it's $100 at this vendor. Through one of our programs, we can get it for $20. Who doesn't want to save $80? Okay? So that's a very easy way to do it. We have prescription discount cards. So you can give these away for free. When you sign up as an agent, we're going to send you 1,000 of these right away. We're also going to give you an electronic one, which you can distribute Facebook, social media, email, however you want to do it. Okay? And we also have a diabetic assistance program. It almost seems that, you know, as every day goes by, more and more people are becoming diagnosed with diabetes. It's a huge problem. Okay? And we have a product solution for each one of these. Healthcare savings programs. So we've got our prescription programs on one side, then we've got our healthcare savings programs on the others. Telemedicine programs, dental and vision programs. Now, the telemedicine program is probably one of our fastest growing products. It's touted as being one of the fastest growing products within the next 5 years within the entire healthcare industry. Why so? It's very inexpensive. It's easy to use. And once a person has used it, they're never going to not be without it. Okay? Now, I myself have a telemedicine program, and if you join as an agent, you're going to get the same program that I have. Okay? I got into telemedicine about 3 years ago, and it was a product that I thought to myself, well, you know, I don't really know much about it, but I'll get it. Okay, so I got it. A couple of months went by. Then we woke up on a Saturday morning, and one of our children was sick. So what would you normally do in a normal situation like this? You would wait until Monday to go to the local doctor if you could get in on an appointment. You could either go to an urgent care facility and pay whatever the cost was there, you know, $80, $90, $100. Or if it was really that bad, you would take them to the ER. But what we did was we got our telemedicine program out, we called it. They called us back within about 20 minutes. They gave us a diagnosis over the phone, and they called in a prescription at our local pharmacy. This was all done from the comfort of our own home within about 30 minutes. Now let me tell you, once I'd used that program once, I made sure that we would never lose that program. Okay? And that's the power of that program. Once you've used it, you'll never lose it. It's like, you know, if you use AA, you know, the AAA, Automobile Association. You know, your car breaks down, you think you'll never need it, but when your car breaks down and you call them and they come and fix your car, get you home, you make sure you keep that when the renewal comes in. Telemedicine provides the exact same thing. Everybody needs a telemedicine program. You know, even if you have coverage, and I have coverage, health insurance coverage, I don't want to have to wait in the doctor's office. I don't want to have to wait for an appointment. You know, call in on Monday, yeah, we can see you in on Thursday. That's no good for me. I want to call today. You know, so it's a great program. It's very powerful. And again, you can build a great business providing these programs. Dental and vision programs, we know about these. Again, it's another cost savings program. You know, go into a dentist, the bill's $1,000. Through enrollment in one of our programs, they'd get a contracted rate and maybe save them, 20 or 30%, something like that. It's very inexpensive and very easy to enroll folks into these programs because the benefits for them in terms of what they get compared to the price that they pay is, it's a no-brainer for most people. So, with the problems faced and the products we provide, there really is no greater opportunity than what we've put together. You know that we have a problem. You know that the market exists. You now know that there's a series of products that are available to fill those gaps. And that's really all that we need to do. No other company provides you with as many business building tools as what we do. So when you join the revolution, we're going to give you personal and co-branded websites, leading edge online and physical marketing materials. Now let me tell you, we have a healthcare provider marketing program that no other company does. It's leading edge, cutting edge. Okay, it's one of the reasons that a lot of agents come to Lone Star. We're going to give that to you for free when you join as a business builder. All the training, videos, webinars, the opportunity presentation. Okay, so if you're going to be in recruiting mode, or you want to share this opportunity with others, all you have to do is send them to a website. That's it. You don't have to sell our opportunity. The opportunity sells itself, but what we're going to say, train you to do is send them to this website, let them take a look at the video. Okay, let them decide for themselves whether that's something that might be of interest to them. They'll review the video. If they want more information, they'll ask for it, and then we'll take it from there. But we're not going to ask you to be able, to be doing that. That's just one of the features of, joining our company. So we're going to give you all the tools that you need to be able to succeed in this fast-growing business. So our agent program is going to allow you to tap into a unique business model. Again, with what we've put together, no other company is like that. We've made it possible for anybody to build a successful business. There's no, you don't have to buy stock in our business. And by stock I mean, an inventory. You haven't got to get a monthly auto ship of, 500 cans of juice. And within 3 months you've got more cans of juice in your garage than you know what to do with. You don't have to do that. Okay? There's no hassles associated with our program. You join our company, you follow the training, you plug into the turnkey systems, you're going to have success. No other program is going to give you the same opportunity that we do, because not only are we just looking for referrers, people that can refer people to the recruiting opportunity, people that can refer people to our doctor office marketing program. Okay? Here's a letter. Read it. If you like it, great. If you don't, that's okay too. With our discount cards, you can distribute a discount card for free. On the bottom of the card, it's going to tell them, or it's going to give them a call to action that basically says, if their medication is more than $20 a month, call this number. That number is to our home office in New York. They're going to call that number and say, hey, I'm trying to fill a prescription. It's costing $40, $50, whatever it is, dollars a month. Okay, what is it? We're going to qualify them. We're going to enroll them in a program, product, or services if we can. Okay, we're going to say we can save you 20, 30, 40, whatever dollars it is per month, and we're going to enroll them in that program. Now, what's great about that is that we're going to give the credit to the agent who that card belonged to. So on the front of that card, it's going to have your RX group number. They're going to call in. We're going to get that number. We're going to do the qualifying, the enrollment, and then we're going to give you the credit for that. Again, no other company is doing that. What other company do you know that is basically looking for people to be referrers and pay them at the same time? Okay, most companies would probably steal that enrollment from you. They'd say, no, they called in, that's a house account, we're going to keep it for ourselves. Well, we're not like that, we're not going to do that. If you distribute the materials, distribute the message, help us build our mission, we're going to compensate you for doing that. because you know what? That's the way it should be. So, again, just a quick recap before we move on. You've looked at, the company, the market, the products, why it makes sense. Let's look at what's involved in being what we call a Lone Star Business Builder. We're going to go through the key features of this program so that at the end of it, you know exactly what it entails. There's an initial sales and marketing kit that we send. We're going to provide you with some electronic sales tools. We're going to give you an enhanced compensation plan, an enhanced training program, which is really hands-on, and a powerful set of recruiting tools for those of you that are in the recruiting business. So we're going to take each one, separately or individually, and just kind of run through what's involved in each one. In terms of the electronic sales tools, you're going to get a replicated sales and enrollment site. So it's going to look identical to our main corporate site, except it's going to have your contact information on. The recruiting site is already set up and built. Maybe some of you have already come through that system. You basically just refer people to the website, which is rxbizopportunity.com. Just simply refer them to that site, ask them to watch that video. If they want more information or to register for a webinar, all they've got to do is just plug in name and email. That's it. No pressure, no sales, no nothing. Okay, very, very simple, straightforward stuff. We're going to give you a back office to manage your business, so you can log in and view your enrollments, view your customers. We give you a corporate email address. We also give you an electronic discount card app. So remember how I spoke about how on your discount card it's going to have your unique group number. We're going to provide you with one that's electronic and is basically an app on your phone. All you have to do is just distribute that. So instead of a physical card, now you've got a electronic card. So there's lots of ways for you to become that referrer. Okay. We're going to give you access or show you how to get involved in an autoresponder and CRM, so that you can, put your leads in there if you want to, and send them on a drip campaign over a series of, emails or a series of time. But again, we've got a lot of tools available to help you build your business. Once you've signed up, we're going to send you an initial sales and marketing kit, which is going to be the physical materials that we've got. So it's shipped upon your initial enrollment. It's going to have 1,000 RX cards or discount prescription drug cards. One side is going to be the standard discount card with your group number on it. The back side is going to be a personalized business card with your your name and telephone number, that sort of thing. So you can market both sides of it. We're going to send you 50 color prescription flyers, 50 recruiting flyers. Okay, for those of you that want to share the opportunity. We're going to send you 30 color brochures, 15 of our prescription assistants, and 15 of our Select RX program. We're also going to send you some information on our free doctor office marketing kits. Our doctor office marketing kits are supplied free of charge. Okay. Now, what's involved in a doctor's office marketing kit is once you get a doctor's office, okay, so here's how the program is going to work. There's a letter and an order form. Okay. All you have to do is distribute that letter. You can fax it, you can mail it, you can email it, you can take it in person, but all you have to do is distribute that letter. That letter is basically a very nicely produced letter that indicates, the products and services that we have, maybe some of the problems that they're having within their doctor's office, and how we can be of an assistance to them. If they like what they hear, they can send in a fax order form for a free doctor's office kit. That kit's going to include a 2-foot by 3-foot poster, color poster, okay, that they can put up in their waiting room. And it's going to include 1,000 appointment cards. So when you go to the doctor's office and you go in and you come out again and they schedule you for another appointment, they usually scratch it down on an appointment card and hand it to you. We're going to provide those to the doctor's office. Okay. Obviously, one side has the appointment information. The other side has obviously our marketing piece and a call to action. And we're also going to provide them with 50 prescription assistance brochures. Okay, those kits are provided free of charge. So all you have to do is distribute that letter, distribute that fax order. Once you've secured and we've received the fax in, okay, any enrollments that come out of that doctor's office is going to be coded to you. Okay, you'll be assigned that doctor's office. That'll be coded to you. Any enrollments that we get from that office is going to be coded to you. But the kits that we send them, so the poster, the appointment cards, and the brochures are going to be supplied free of charge, provided that you are a business builder. So, enhanced training. We have our own separate website. Part of that website is for the standard sales materials, product materials, but there's also a password protected side which is going to be covering all of your marketing training. And we're going to have a warm market and referral module. These are all separate trainings. A small business market module, a diabetic market module, a social media marketing module, Facebook training. Now that's pretty big because most people have a Facebook account. So we're going to actually show you how to use Facebook. We're going to show you how to use a Facebook business page. You'll have your own Facebook business page or starter page, and you'll be part of your own private Facebook group where you can log in and share ideas, tips, resources, and we're all involved in that. So sometimes we get a great idea, we're going to distribute within that. That's all part of the enhanced training that we provide, which really sets us apart from a lot of other companies because we're really big on training at Lone Star. Once you get involved with looking at becoming a business builder, and once you actually become a business builder, you will see the level of resources that have gone into what we're doing. Okay, and it's all designed to support the agent, to help us grow that mission of reducing the out-of-pocket costs, reducing the healthcare out-of-pocket costs for the individuals throughout the country. We're also going to give you 500 recruiting leads a month along with your replicated recruiting site. So, every month that you're a business builder with us, we're going to send you 500 leads or 500 names, address, emails, telephone numbers of 500 folks that have made a request to hear some more information on, starting their own business. Maybe it's a home-based business, that sort of thing. You can put these into a CRM, an autoresponder. We'll show you how to do that. Okay, we have access to 2 great autoresponder programs where you can just send out, a general letter, call to action. Hey, take a look at this. If it's for you, great. If it's not, that's okay too. All these tools and resources are provided for you to help you build that business and help you build your, your business. So not only do we provide you with 500 recruiting leads, but we're also going to provide you with 500 pharmacy consumer leads. So these are opt-in leads where people have indicated that they purchased medications through an online pharmacy. Okay, so maybe they've gone online and made an order for a medication and they want some more information on how to do those, make those orders. So these are opt-in pharmacy consumer leads. They've either bought prescriptions in the past or are in the process of buying a prescription. 500 healthcare provider leads. So for our doctor's office program, you're going to need to know the names and addresses of folks to be able to contact in your area. We're going to provide you with those. Okay, we're going to provide you with 500 a month based upon your geographical location. And these are going to be internal medicine providers, your regular, 9 through 5, Monday to Friday, internal medicine. Okay, great prospects for, delivering our message and providing that doctor office or that marketing letter to them. And that's in addition to your 500 business opportunity leads. So that's a total of 1,500 leads a month. Now, whether you call them leads, lists, whatever, but we're giving you 500 names, numbers, telephone, fax numbers, emails, whatever, of people that either need our service or have a potential need for our service or want to start their own business. Okay, so we've got you covered in every single way that we can. Okay, because at the end of the day, when you go through this, we want you to know that we've provided you with everything that we can to help you be successful. Okay, what's better than 500 names, addresses, telephone numbers of folks that take prescription medications? Okay, what's better than the names, address, telephone numbers of 500 centers of influence that could use our products or services? Okay, what's better than 500 names, addresses, and telephone numbers of people that are looking to start their own business? Okay, we've got you covered in every which way that we can. That's a total of 1,500 leads, names, addresses, telephone numbers per month. You're also going to get enrolled into our dental program, vision program, and telemedicine program. We believe that as a company, it's important that you own what you sell. Okay. In terms of the telemedicine, trust me, once you've used it, you'll never lose it. Okay. You might think that you'll never use it, or it's a product that you don't have a need for, but you never know when you might need it. And once you do use it, you will never lose it. Once you get enrolled into our Business Builder program, we're going to send you your booklet and your ID cards within about 7 to 10 days. And again, the neat thing about this is that it's going to cover all of your household dependents. So not only are you getting into a business, to help others save on their out-of-pocket costs, you can also save on your own out-of-pocket costs. Again, you wake up on the weekend, don't want to wait for the doctor's office, you just call that number. The guaranteed turnaround time is within 60 minutes. They call you back, they let you know what's going on. Maybe you've got a cold, call in some antibiotics to the local pharmacy, away you go. Okay, so you're going to have access to that great program too. So we've looked at recruiting leads, business leads, physical materials, electronic sales materials, enhanced training. If that wasn't enough, we're also going to pay you a commission too. Prescription assistance program, we'll just go over these quickly because it might not mean that much to you at this point. But there's a 25% commission. So whenever a customer signs up for one of our programs, they're going to make you're going to make a 25% commission for the amount of money that they pay us on a monthly basis. For our Select RX program, that's a monthly membership program. It's $29.95 a month, so you'll make 30% of that month in, month out. Dental and telemedicine, again, is the same, 30%. If somebody does happen to fill a prescription with the free discount code or the free app that you've got on your phone, you'll get paid $1.75 per claim. Really, we don't want them to do that because we want them to call us so that we can, figure out what the problem is and provide them with a better solution than using that card. Okay, but if they happen to use it, you're gonna be able to make a little bit of money on that. We also have a sister company called BuyContactsForYou.com. That is a full online program where people can buy their contact lenses. We are guaranteed 20% cheaper than 1-800-contacts.com. And we pay you a 10% affiliate commission on that. You don't have to do any selling or anything like that. Again, it's just a case of referring people to the site. You refer folks to the site, they make their orders, you'll make a commission on that. If you plan on recruiting, you're going to make a 5% commission on your immediate downline, and you're going to get a 6-month advance for our Select RX program, our dental and telemedicine program. Now, as an added bonus, the dental and telemedicine program is actually going to be pushed to a 12-month advance starting January 2016. So you enroll somebody in a telemedicine program, we're going to pay you the whole commission up front for that entire year. Okay, so that's a very powerful program. So that's our enhanced compensation. So how do you make money? Well, obviously the beauty of this business is the recurring income, being paid over and over again for something that you did last week, 3 weeks ago, 3 months, 3 years, 5 years, whatever it is. That recurring income being paid over and over again. That's the purpose of being in a business like this, because you can provide that solution, a solution that people use every week, every month. Okay, maybe it's filling a medication. They're going to fill that medication every month. You're going to continue to be paid on that. So imagine being part of a system, or a part of a proven system that's easy to duplicate. That's one of the key things that you have to look for in any business. Can you refer people to a website to recruit people? We believe the answer is yes. Can you refer people or distribute a discount card for free, an electronic discount card for free, or a doctor office marketing letter? Can you do those 3 things? Okay, now note that we haven't asked you to sell anything. We've not said go out and find 25 customers all on your own without any help. What we've said is, can you refer people to a recruiting website, and can you refer or distribute those materials? If you can do one of those or both of those things, you're going to make some money from it. Okay, there's no question about that. You can make money from one or the other, or as we say, better yet, let's do both. Okay, a lot of business opportunities that are out there, they will either send you one way or the other. Okay, they're going to tell you it's all about product, and you've got to sell products, you've got to have an inventory, you've got to have an auto ship of products every month and go sell it, or you have to build a downline. Okay, and then it's it's a complicated downline system where you've got binaries and levels and hierarchies and that sort of thing. We don't have any of that. We're going to show you how you can make money from personal enrollments with an override and from team building. Okay, and it's a pretty simple, straightforward concept. It's never been a better time to get involved. Again, I go back to the strength of the market. It's going to get better, it's going to improve, it's going to increase, and you're in a position now to be able to tackle that head on, provide that solution to that problem. Once you've provided a solution to a problem, you will make money. So let's take a look at how you make money in terms of a team building override or team building compensation. We've already spoke about this. 2 ways to make money: team building, direct enrollments. Okay, what we're very big on at Lone Star is what we call running to daylight, or recovering your initial investment. Okay, once we've shown you how to recover your initial investment, and we do it through a 5x5 program, okay, within the first 30 days. Once we've done that, you're going to be very happy. So how to recover your initial setup fee of $159. Okay, each time you directly recruit somebody into your team and they sign up as a business builder, you're going to be paid a $30 commission. Okay, obviously within that $159 sign up fee, there are a series of things that you're getting. They're getting enrollment in the dental vision telemedicine program. They're getting an initial set of physical marketing materials. They're getting access to all the electronic tools. They're getting all their websites set up. Okay, they're getting all their training. Okay, so once they sign up for that program and become a business builder, you're going to make a $30 commission off each one of those. So you can see, with only 6 direct recruits, okay, you're going to recoup your initial investment. If you do 5, you're going to be at $150. Okay, just $9 short. We call it a 5x5. We want you to have 5 new recruits in the first month and 5 new product enrollments in the first month. Either one of those is going to recoup your investment. Okay. Now, how do you recoup your monthly fee? Okay, so there's a monthly fee of $39.95, and as the recruiter, so let's say of those 6 people that you've recruited, every month they're going to pay their $39.95. You're going to receive a $7.50 commission. Okay. What do they get for that $39.95? The same thing as what they got, month 1 when they signed up, except they're not going to get the physical materials, but they're going to have access to replicated websites, back office, the electronic discount card, all the trainings, conference calls, all those things that are going on at Lone Star. They get access to all of that. They pay their monthly fee. The agent that enrolled them is going to get a $7.50 commission for as long as they're an active business builder. So again, with only 6 paid direct recruits, you're going to recoup your monthly investment pretty quickly. Okay, $45 is what you'll make. Your actual monthly investment is $39.95. So that's just if you do it from a recruiting standpoint. We haven't even looked at, the product enrollment side of it. But what about if one of my agents recruits a new business builder? So each time one of your recruits signs someone up as a business builder, okay, so there's yourself, you've recruited somebody, and then they go one step further and they recruit somebody under them, you're going to be paid a $10 override, okay, in addition to your direct level compensation. So in this example, your level 1 or your direct recruit 1, which is your first level, you're going to receive $30 per each direct recruit, and then for each indirect recruit, it would be a $10 override. Now this is as complicated as our system gets. It stops here. There's no levels beyond the indirect recruit. Okay, there's no multiple levels, binary systems, legs, layovers, crossovers, whatever you want to call it. This is as difficult as it gets. You directly recruit somebody, you make a $30 override. Okay, if one of your agents underneath you directly recruits somebody, you make a $10 override. That's it. Okay, pretty simple, pretty straightforward. So in this example, to kind of go on that, with the 6 direct recruits, you've made $180 because it's $30 a recruit, but then you're going to make a $60 override from the 6 indirect recruits for your total compensation of $240. So you can see here that by just referring people to the program, getting them involved in the Business Builder program, providing them with the same opportunity, the same set of tools, same set of resources, you can make money from it. Okay, and that's the key. And again, to go back to this would be for your monthly recruiting commissions. So, obviously you're going to make $45 from your direct level recruits. One level below you, okay, you're going to get paid $2.50 for the indirect. So again, this is as difficult as it gets. Direct level recruits going to be $10 a month, $7.50 a month, sorry, and then below that is $2.50 a month. That's it. Now, naturally, to keep it simple, to keep it realistic, we've shown you what the results are from very minimal recruiting. But what if you had 100 business builders on your team, 400 or 1,000? You can do the math on this thing yourself. Okay. What we're not is a complicated system. We're not a difficult system to understand. So if you had 100, 400, or 1,000, figure it out. You can see that there's some money to be made. Now add this to your monthly recurring commissions from product enrollments, and we believe that you've got a fantastic business opportunity here. Okay, it's not a case of one or the other. It's a combination of both. When you do both, based upon product enrollments and recruiting, you can end up with a nice monthly income stream. So let's recap for a moment. At the start of this presentation, I told you that at the end of it you would say, is it real? Can I do it? And will they help me? Well, obviously we've shown you the size of the market. We've shown you the problems that people are having. We've shown you the solutions that are available. And we've shown you how we're going to help you do it. So you've now be in a situation where you've discovered a real way to solve a problem for millions of Americans. Okay, and we're not just talking about a small problem either. We're talking about a huge major problem for a lot of Americans. A system that is easily to duplicate. Okay, that's the key. We've put together a program that you can easily duplicate. We're not looking for salespeople. I mean, if you can sell, that's great. But if you can refer people to a website, if you can distribute some marketing materials, you're going to have a lot of success in this industry. We've provided an opportunity that's giving you all of the tools, all of the resources, and all of the support necessary to become successful and make money. Okay, and that's the key. So, we do believe that there is no other opportunity that provides this level of turnkey marketing system. There's systems out there where it's either a turnkey system for recruiting or a turnkey system for driving enrollments in a product or a sale. We've put together something that does both. We've got great product solutions, great tools and training, great people to work with. Our executive team here at Lone Star is pretty on the ball. We've been doing this a long time. We know what works, what doesn't work. We're very apt to changes in the market. And you also see there's some great income potential. You've also noticed that the market is growing exponentially. And because of that, you've got a fantastic opportunity to get in on a business opportunity that can help you make a decent income. So in order to join the revolution, which is what we call it, we say this is the healthcare revolution, and our revolution is twofold. It's through products like telemedicine, and it's through products like prescription assistance, and through our Select RX program. Joining is pretty straightforward. Just go back to the person that invited you to this webinar. If you need to contact us directly, go ahead and do so. That's fine too. We can refer you back to that person as well, and they can get you started in about 10 minutes. It's never been a better time to get involved in our business or in our opportunity. The sky is the limit with what we're doing here. You're in the right place at the right time with the right set of products. Don't let this type of opportunity miss you or go by you, because it's just incredible. Get involved, start today, sign up, become an agent, become a hero, and make some money as well while you're doing it. So thank you for listening. Welcome to the revolution. Let's get started. Let's get going. We hope that you've figured out that this is a great opportunity. If you have any questions, feel free to contact us. Thank you for listening. We look forward to working with you.